Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by KidneySolutions.org.
Hello, everyone. This is Kent Bressler, and we're going to get started on our podcast this morning. I have two great guests that I really want to get to this morning, and so let's start with a prayer. God, life storms can be relentless, and we often feel weak in the face of adversity. Grant us the resilience to weather life's challenges with grace and courage. When we stumble, lift us up and renew our strength. Help us bounce back with setbacks and grow stronger through the trials. Thank you for being our constant source of encouragement and support. And we ask all of this and these requests of thanks in your name. Amen. So before we get started this morning, I want to make sure that you go to this website, KidneyCAREStudy.org. That's all one word, KidneyCAREStudy.org. If you click on that, you're going to be able to fill this survey out for all of the people at the National Kidney Foundation, but you'll be part of a great research project. So today, I have Rachel Claudine, who is the Patient-Centered Research Director at the National Kidney Foundation, and she is focused on the advancement of this KidneyCARE study. And she's also someone who's living with lupus nephritis. And she's been excited for the patient-entered data collected by this study. In other words, this is all patient-entered, not centered, entered. All right? And previous to this NKF assignment, she's worked in the hospital and the hospice settings and has advocated for patients utilizing the shared decision-making model of healthcare. That's just a big term for it works best when everybody's in on the program. So, in our second guest, thank goodness for both of these gals, but Sandy Gilbert, Dr. Sandy Gilbert, and she's the Senior Director of Patient Outcomes Research at NKF, where she manages this kidney care. That CARE stands for Community Access to Research Equity Study. Since joining NKF in 2024, she's focused on developing and overseeing this pioneering National Kidney Disease Patient Registry, the first to integrate patient-reported data with clinical data from the electronic health records. A monumental task, but something that is long in coming. It's going to be very valuable in the future. So this Kidney Care Registry is an ongoing study that includes adults from all types and stages of kidney disease. The goal is to generate clinical and critical insights into disease progression, treatment outcomes, and health disparities. And that's done by capturing it from the patients. All right, not from the researchers, but from the patients themselves. And we get to do by capturing real world patient experiences. You remember, we always say you got to tell your story. If you don't tell your story, nobody knows what's going on with you because kidney disease is so silent. All right. So this whole process, it has no racial, ethnic, or socioeconomic boundaries. It's something that the registry aims to provide a more comprehensive understanding of kidney health. In other words, down to earth, everyone gets to understand it because it is so nebulous. It's out there, and it's very difficult to have this kidney disease and get an understanding. It's difficult, very difficult. So, Sandy, I want to ask you a question. You ready?
I'm ready.
Here it comes. What's this KidneyCARE study, and why is it so dadgum important?
Yeah, thanks for having us on the show to talk about this, Kent. So, the KidneyCARE Study, you gave a nice introduction, but it is the first national patient registry for adults living with all types and all stages of kidney disease. It's going to combine the patient reported information with clinical data that we get from electronic health records. And this will give us a very comprehensive picture of how kidney disease affects different individuals. The study is groundbreaking because it's going to help researchers, doctors, and even healthcare policymakers understand kidney disease better. Some of the top questions that we're hoping to answer with the study are, why does kidney disease progress faster in some people than in others? And I think a lot of patients wonder this themselves because they often know other people who have the same disease and at a similar stage, but one person might be progressing more rapidly. Why is that? Another question is, how well are treatments working for patients out in the real world? The treatments are first studied in clinical trials, and that's a very narrow, select patient population. But once you go out into the real world, you get many more people, sometimes some people who are even very sick on it. And we want to kind of know how they're doing on this also. And why does a certain treatment work well for one person, but not for another? And I'm sure you all know of lots of examples like that. So what makes this study really special is that it puts the kidney patients right at the center of the research. By collecting direct input from patients about their experiences, their symptoms, and how they're responding to treatment, we can better understand what works best for different people. This kind of real-world data will help researchers develop more targeted and personalized treatments. And we hope that's going to move us closer to a future where kidney care is tailored to each person's unique needs. And Kent, I have a question for you because I know you've been really involved and helped us with the study. You've served in an advisory capacity for a couple of years now. And thank you for all that you do. So how important was it to you that the patient experience be captured in research?
I've had FSGS for nearly 50 years. I've been transplanted. This disease process, FSGS, is a rare kidney disease that it's difficult to explain in regular human terminology, but it's progressive. It moves on. It doesn't have any friends, and it ruins your kidneys. At some point in time, they fail. Early on, when I first got FSGS, when Dr. Mulgrew told me about it, and that he told me that, you know what, we don't have much medication. We don't have a lot of treatments for this disease. Matter of fact, we definitely don't have a cure, and that's not changed. Very little has changed in this field in FSGS. But that doesn't mean that there hasn't been great advances in the other areas of kidney disease. All right. And I could explain those out, but just in general, people who have kidney disease and these diagnoses like, IgA and PKD, they all understand the process. But what they really want to see, and I think I can speak for a lot of them, they want to see continued research. Everybody wants a cure. You don't get a cure by not asking patients what's going on with them. You can ask the researchers and that, the ones that look through the microscope. I think they get a pretty big kick out of hearing people's stories. And that's what's the most important part of kidney research is the patient stories. So this registry is an important, very, very important part of letting you to tell your story. That's exactly the reason I'm doing this podcast today. I think it's so dadgum important that I encourage everyone to get involved at that level and do this survey. Tell your story.
Thank you, Kent. And, we really want to hear from everybody.
Absolutely.
Doesn't matter if you're early stage disease, it doesn't matter if you're in the late stage of disease, if you're on dialysis or in transplant, we want to hear what's happening with you and we want to follow you over time. So, we started this a year ago, but we plan to do this indefinitely into the future. So we check in with people every 6 months and get an update on how they're doing. So that's all very important for helping us to follow disease progression over time.
That's what's important, is the following of it.
Yeah.
Everybody wants a quick cure. There is no quick cure in this.
Yeah, exactly.
If you want a quick cure, you got the wrong disease. You need to get a different one, because the kidney disease is so progressive. And it's different for everybody.
Mhm.
That's just the way it is. It goes fast for some, slow for others. Some outlive it, some don't. But you can't predict it. And that's what
Right.
research does. It makes it easier to predict outcome. And that's why we do this. All right. So here's another question for you. How have patient registries made a difference for other disease processes?
Yeah, these patient registries have been game changers in medical research, helping the doctors and the researchers understand the diseases better so that they can develop treatments for them. A registry is kind of like a giant health journal that collects information over time, and then people can comb through that data and spot patterns. Registries that include direct input from patients, such as their symptoms, their quality of life, and their experiences with various treatments, offer a tremendous potential to drive medical breakthroughs. And one great example of this is cystic fibrosis. The Cystic Fibrosis Foundation started a patient registry almost 40 years ago, and they've just been following people over time and seeing how their disease has changed. So they've been tracking 50,000 patients over this long period of time, and they've been looking at their health outcomes and how they respond to treatment. By analyzing all the data they collected over those years, they were able to better understand the disease progression, and that led to some breakthrough treatments that have dramatically improved life expectancy for people with cystic fibrosis. It's also improved the daily quality of life for people with cystic fibrosis. And success stories like that show how powerful a patient registry can be. So the KidneyCARE Registry is taking the same approach, but for kidney disease. So we're going to combine medical data from electronic health records with patient-reported experiences. And the whole goal of this is to find better treatments and maybe even cures someday. The more patients who join the study and share their experiences with us, the more we can learn, and the more likely we can find some kind of discovery and treatment that can transform care and improve lives.
That's we're not going to give up on you, Rachel. You hang in there. We're going to get to you too. And okay, I got one more question for you right now, Sandy, and how is this KidneyCARE study planned to build on the success of these other registries? I know NephCure has a registry for FSGS. It's very specific, although it's not been enhanced and it's not currently working, but it's available, all right? And so how is that going to work? How are you going to build on the success of these registries?
Yeah, like those other registries, our registry was created to help fill gaps in the understanding of disease. Kidney disease has been historically under-researched compared to other conditions like cancer or diabetes, and there's a number of reasons for that. So because we've had fewer registries and large-scale research initiatives in kidney disease, the progress in understanding and treating kidney disease has lagged a bit behind. So we want to change that now by building this really powerful data set with so much data in it from, people with many different types of disease over a long period of time. And then the researchers can look through that and try to find patterns in disease progression, patterns in treatment effectiveness. Why does this group of people respond well to treatment, but this group of people isn't responding? And also who's having better outcomes. So those insights could lead to better treatments that could either slow disease progression or maybe someday even cure it. Another really important area of research that we want to contribute to through the study is understanding, is kidney disease really asymptomatic in the early stages? Because right now, people have the impression that there aren't many signs in the early stage of disease that you have kidney disease. And so people don't get diagnosed until they're in a late stage of disease. But maybe through this study, we'll be able to discover some of the early warning signs that previously went unnoticed. So if certain symptoms could serve as early warning signs, maybe patients and doctors could pick it up sooner, and then people could get on treatment sooner, and then they'd have better long-term outcomes. So maybe fewer people would actually end up on dialysis or need a transplant if we could identify it and start to intervene earlier. And if we could just do that, if we could just reduce the number of people who need dialysis or a transplant, that would be such a major step forward in kidney care. So I'm kind of hoping that will come out of the study. And in addition, we're building a clinical trial ready database, and that can help to accelerate drug development for kidney disease. So because we're collecting a large, well-characterized patient population, that makes it easier to enroll patients in clinical trials. And when people sign up with us, we ask them the question, would you like to be notified if you became eligible for a potential clinical trial opportunity? And 70% of the people registering for the study say that they do want to be contacted about potential clinical trial opportunities. So there's a lot of excitement, a lot of eagerness to participate in these things. And that could help to speed up the process of testing new therapies. And that would make them become available to patients more quickly. So the KidneyCARE study isn't just an intellectual exercise to understand kidney disease. It's about really changing the future of kidney care and bringing new treatments to people and getting them out there as quickly as we can.
You made the statement that early warning, finding
Mhm.
symptoms. And to
Mhm.
my knowledge, and we've stressed this in our groups and with patients, that early screening is an important part of this whole process. This research project would help in that screening process. We know that protein in the urine, albumin in the urine, if you will, it shouldn't be there. All right. And that's a simple $5 test, a urinalysis test. And a lot of times we don't use it. All right. And there's some simple blood tests that could be used for screening. And there's more action in that area. But this research project will, I really believe, give us some concrete evidence that early warning signs are there. You just don't know them. So that's very important. Well, Rachel, now it's time for you. You sit there patiently waiting for your questions. And I understand that you have lupus.
I do. I was
Well,
diagnosed when I was 7 with lupus nephritis. I've been living with lupus nephritis since then. Thankfully, I am in remission, but I did a lot of different types of treatments when I was younger. So I definitely have experience as a pediatric kidney disease case.
Yeah, that's amazing. It's some really good friends in California, a couple of them with lupus. One's a male, which is very rare.
Oh, which
And I
is
would
rare,
like to
yes, for our
connect you.
audience, that it usually
Yeah,
affects
yeah,
females.
he'll be listening in, and his name is Emmett, and we'll connect you. You should just come to our support group. You would be a good speaker at that. Both of you would actually. So okay, so here let's get back into the lead thing here, Rachel. Why in the world would a patient with kidney disease want to consider joining this study? What's the deal?
Sure. And thinking about the KidneyCARE study, as we've been mentioning this entire time, this is a very patient-centered research study. And every kidney patient has a story, and all of those stories are going to be the key to better kidney care treatments. And by taking part of this study, patients will directly contribute to research that can improve care for themselves and for future generations. It's really a meaningful way to make a real impact, but you don't have to go to extra doctor's visits or have to do any type of experimental drug treatments. Patients are really just reporting on their own lived experiences, and it's going to help researchers better understand the disease from a patient point of view. And what's different also about our study is while you are a part of our study, participants can access educational materials about kidney health and support resources that can help participants manage their health and really be able to make more informed decisions about their care and ultimately really understanding kidney disease. And as you've said, Kent, you've been a part of this process this entire time. And what has been the experience of being a part of the KidneyCARE study so far for you?
Well, I took it the other day for the second time. I think I took it a while back, but it flowed real easy. One of the things that I had difficulty was the timing. It seemed like it lagged, but I found out that's from my phone.
Sometimes there are connectivity issues.
Exactly.
But I am always there. We do have a support with that.
Yeah, I mean, this is an opportunity to actually learn about kidney disease too. A new person, someone who's just been diagnosed, well, you think, well, why would we want to talk to them? The reason we would, because they don't know that much about it. And when they have to ask a question about, well, what's an EGFR or what's this or that, and we have ways that the Kidney Foundation can get back with them. I mean, it's not that you go in and you mess up. We can monitor that, right? We can monitor that, the activity on the survey, and you, excuse me, can always get your questions answered. And if it drops off, it kind of, what I like about it is saving all the time. All right. You may go through a survey sometime, especially on a phone or laptop or whatever. You get halfway through it and it breaks or it stops, right? But this one, it's right to the time that you get to it, it's been saving all the stuff, all the steps. So you get to go back and start over from where you were, not from the beginning. And I think that's really a valuable thing for people to know. But we want everybody to do this. We don't want a person who's like myself, who's had this stuff for 50 years. We want them, and we also want the ones that just found out. And that's really probably the ones that would really be helpful, because we could follow them. Mine's all back, in retrospect, but a new person, a newly diagnosed kidney patient, the world, it's like Sandy said, it's a journal. You get to tell your story. Yeah, so this survey is a good deal, no matter how you look at it. And I told you that we spent time last night after our support group. We had over 40 people on our support group last night, and I think the vast majority of them went into KidneyCAREStudy.org and have started on the survey. And I'll query them again next Monday night and ask them, how many of you been on? And we'll keep doing that. And then our database, we will also send it out to people that haven't been attending the support. We have a huge database, and we'll just send it to them. So I think that's the way that this gets out there. Once you've taken it, tell people about it. All right? You're sitting in your doctor's office and you got 3 or 4 patients, or you're at the dialysis unit. You just say, oh, hey, by the way, I just took this survey. Get on this KidneyCAREStudy.org and do this survey. They really need this information. I mean, that's how it gets out. So, okay, which patients are eligible to participate, and how can they really join? How do they get started?
Sure. So the KidneyCARE study is open to adults 18 and older in the United States who have been diagnosed with any type of kidney disease. That includes rare disease diagnoses such as FSGS, IgA nephropathy. And we also are asking those who are on dialysis or those who have received a kidney transplant to be a part of the study. Joining is easy, as we've maybe talked about the entire time. KidneyCAREStudy.org is the website to get started. You can click on the sign up button to be able to fill out a few questions about yourself to create an account. And then you can read and sign our digital informed consent form to officially join. After that, you will be asked to fill out 3 surveys that ask questions about your health and your symptoms and your quality of life with kidney disease. Because this is such a long study, we do check back with you every 6 months to update those surveys, tell us if there's any changes in your kidney disease progression, and be able to tell us about the challenges of living with kidney disease. And this allows us to track disease progression over time. And we want to make sure as many people as possible can join the study. So we do have translated all of our study materials into Spanish as well. And people are welcome to participate in either English or Spanish and whatever is really more comfortable for them. And the future updates and follow-up surveys will also be available in both English and Spanish. And by making this study accessible to Spanish-speaking participants, we hope to include a diverse group of people living with kidney disease. As we've mentioned before, KidneyCARE, that care means community access to research equity. We want all diverse participants to be able to join so that we can have research findings that benefit everyone.
Let me just clarify, and there might have been a break, but most of these anybody can fill it out, including those with rare type diseases like FSGS and IgA neuropathy and diabetic kidney disease, right? And hypertensive kidney disease. So anybody's qualified as long as you're 18 years of age or older. So that's really the takeaway of this. You get on there and you get busy doing it because it's very important. Okay, so how is patients' data protected? People say, I don't want to give up my Social Security number. I don't want to do this. How do you protect a patient who comes on and spills their guts?
Yes. Protecting patient data, as you said, Kent, we always want to be able to make sure that protecting the data is of utmost importance to us. It is one of our top priorities, and that's one of the ways that we want to make sure that patients feel comfortable is being able to explain how our patient data is kept in a secure manner. So the KidneyCARE study follows strict security protocols to ensure that all participant information is private and secure. Any data used for research is de-identified. And what de-identified means is all personal details like names, addresses, date of birth, and other identifying information is removed before researchers have access to it. It's all combined together so that the information cannot be seen specifically on a one-person level. This data is stored in a secure platform with multiple layers of protection, as well as the data is encrypted, meaning that it's stored in a secure manner. Only authorized personnel will be able to access it and only for approved research purposes. And we really want to make sure that patients feel comfortable and protected in sharing this information. We want them to know that their data is handled with the utmost secure manners and also the highest level of care and security. And I know, Kent, you just kind of talked about it. Is data security something very important to you? And how have you felt that the KidneyCARE study allows that security?
There's nothing in that survey that was tough to answer. All right. I mean, I felt secure in doing it. A matter of fact, I don't think it even asks for information that is so data protected, or you need to be protected. Everything is protected. I just don't know how to say it other than that. You can't go on a survey that's this big that they haven't kind of run through every rough edge. If you feel like you did that, something may have been compromised, all you got to do is call one of you gals and it's going to be taken care of. I just don't think it's the data part of it's a big issue. I think everything is protected. That's what I think. So, Sandy, a couple of questions here too about what kinds of discoveries are you expecting out of this? What kind on this registry, and then now and in the long run. So what are those two areas that you want to really cover?
Yeah. So the study does have the potential to answer some of the biggest questions in kidney disease. Some people with kidney disease lose their kidney function very quickly, but others remain stable for years. So what's causing that? With the registry, we're collecting so much data on people that we can start to look at what some of the factors are that might contribute to that. Is it one person's genetics is different than another's? Is it that one person has some additional health conditions like cardiovascular disease? Is it that one person is on certain medications? Or is it that their lifestyle choices, are they a smoker? Is there a certain diet that they're on? Because we ask some diet questions too. So all of that's going to help us understand what causes these variations in disease progression and why some people progress quickly and others remain stable for a while. Another question we're really curious about is why do some people with diabetes go on to develop kidney disease, but others don't, even when their blood sugar is poorly controlled? So a lot of people with diabetes do develop chronic kidney disease, but not everybody. So what's happening there? If we understand what makes some people more susceptible to kidney disease, maybe we can uncover preventative strategies that could stop the disease from happening or slow its onset if it does happen. And then we're really interested in lifestyle factors like diet and smoking and how they affect kidney health. And through the registry, we can track those behaviors over time in a large number of people. And that might help us figure out things that are protecting the kidney, or conversely, some of the behaviors that might contribute to kidney function decline. So that type of knowledge, if we could really demonstrate it through this data, would help patients make more informed decisions about their lifestyle choices. So basically, just by collecting all this real world data directly from patients, we want to turn those questions into action and generate answers that will improve people's lives. And then I guess you asked about what type of impact you think the study might have.
In the long run,
Yeah.
everything you do it today, but what is it going to be 10 years from now or 20 years from now? And that you have to project that. You think about that, I'm sure.
Yeah, we do try to project ahead what we could learn and then make sure we're asking all the right questions here and now. So we're collecting the right data that can actually lead us to that point in 20 years. So my hope is that one day we can look back and see that the KidneyCARE study was a turning point in kidney disease care. And I hope someday, because of the data we collected, people can get diagnosed earlier.
Yes.
Maybe because we found some of these early warning signs. And I also hope they have access to new treatments and hopefully even some cures. For too long, the progress in treating kidney disease has been really slow, mostly because we didn't really have enough comprehensive data to guide breakthroughs. But now we're coming into an exciting new era with research and discoveries accelerating rapidly. And I'm sure you've seen in the last few years, there's been some new treatments coming out for some of the diseases like IgA nephropathy or IgAN, or C3 glomerulopathy called C3G. So those were conditions that didn't have any targeted therapies before, but just in the last few years, these have come along, and that's really transforming life for the people living with those conditions. And we think the KidneyCARE study should help to accelerate that kind of progress even more. So, we're super excited too, just like the patients are excited as these developments come along.
It's interesting that, everybody says, well, your kidney is one thing, but there's so many things that affect it. And you just talk about IgN, FCS, FSGS, minimal change. All of these disease processes are part of kidney disease. So when you have kidney disease, it's not usually just one thing. And there's been more identified as research has gone on. So we do know more than we did. We do know more about the glomerulus. We do know more about the protein spilling. We do know more about that. But that's only because of research, not by treatment. Treatments probably haven't come a long ways as we would like, but at least we've got some drugs to work with. Now we can, quote, slow it. Slowing it's one thing, fixing it and curing it is another, and that's what we're after. That's exactly what this study helps us do. I mean, that's just the way it goes. Many times people think, well, they'll come up with a pill or they'll come up with a shot. That's not going to happen here. It's not going to happen at all. What we will do is develop mechanisms to make it easier on patients and make them more comfortable and make them more viable and where they have a longer lifespan instead of just going directly from, finding out they got it and getting on dialysis or getting a transplant. This is very important information that needs to be out. People need to know about it. And if you're out there, you need to get out and join this study. It's very important. All right. So, Rachel, you've been working closely with patients. Matter of fact, you're patients yourself. So what's the most important thing about KidneyCARE study?
I think really the most important part and what's exciting about this KidneyCARE Study as compared to other registries is because it puts the patient at the center of the research. It's not really looking at you as a number. It's looking at you as a whole person. It's understanding the real life experience of how you are living with kidney disease. And by tracking your quality of life over time and seeing how the changes happen as disease progresses, we'll really be able to get a clearer picture of your experience, the others, participants' experiences, and their challenges and needs of living with kidney disease. It's also just inspiring to see patients become more empowered as they really are a part of this study. In the process of sharing their experiences, they'll gain a deeper understanding of how their own health journey is experienced. And it's rewarding for them to contribute to something much bigger than themselves. It's really benefiting the whole kidney community by providing that personal experience.
You know, I remember when I was first diagnosed, and Dr. Mulgrew told me, he said, you know what, we don't have a cure for this. And actually, if we get a transplant, it could come back and haunt your transplant and come back in your transplant. That's by participating in this type of study, how's that going to help you accept the fact that you have kidney disease?
Sure.
And work with it?
Yeah, and I think that a lot of people, they hear this diagnosis, and like we've talked about, sometimes there's not a lot of treatment options at that point, and it can feel overwhelming or feel like there's a lot of burden of what am I supposed to do now? And it's totally appropriate to have that feeling. And we want this to be an outlet of being able to feel like you are taking action and really being able to support kidney research. It's giving patients the opportunity to be a part of research and something bigger and to contribute to the solutions to the issues that they are facing living with kidney disease. And when someone joins the study, they're not just helping others, they're also helping their whole kidney community and those diagnosed in the future. And they're also helping themselves because, like we talked about, once they register for the study, they can access that kidney educational content, access information about clinical trial opportunities, and also access information about peer support that can really help navigate their own kidney journey better.
So what are we going to tell the person who says, yeah, I'm a really undecided, or I don't want to? How do we get them to do it? It's that
Sure.
simple. How do we embolden people to say, I need to do this study?
Yes. And I think that the big challenge is some people think, oh, my voice isn't important, but this study, it is your voice. Research cannot move forward without patients like you sharing your information, sharing your personal experience. And by joining, you're not just helping yourself. Like we said, we are really trying to advance kidney research for the kidney community now and in the future. Something else that we haven't really touched on yet, but especially is evolving as time goes on and what we know will be changing in the future is how kidney disease may also have a genetic component. And some of the insights gained from this study that we are learning from the experiences of people living with kidney disease that have had a familial background of kidney disease, this could also be a way that we are learning more about earlier detection, better treatments, and then cures not just for yourself, but for your family and the future generations. And you have an opportunity to be able to help create a better future of kidney disease treatments. And really the whole process of being able to have a better kidney community that understands and can be treated better. And then just thinking about the logistics side of the study, this is a pretty easy study to take a part of. It's all online. You're able to access those surveys, able to access the KidneyCARE Study from any type of device that accesses the internet. You can do it on your phone. You can complete the surveys on your desktop, laptop. And then there's really no other ways to be able to be having different negative parts of the study. There's no medications to take. There's no new diet. There's no doctor's visits. This is really all on your own time to be able to be a part of the study. And you're filling out the 3 surveys every 6 months. We do send you emails to remind you to be able to fill out those surveys. So really, it's a way to be able to be a part of research from the comfort of your own home.
Okay. This is set for Sandy, and if you want to chime in, Rachel, this would be my last question to you, because we're going to It's been great. I don't want to stop, but I think we've covered a lot of ground here. All right. And one of the things is in the first year, where have we come? How far has it come, this study? What have actually come of it
So we
so
just
far?
celebrated, yeah, we just celebrated our 1 year anniversary, and the progress has been very promising so far. In our first year, we exceeded our patient recruitment goal by 15%. We wanted to enroll 1,000 patients, and we enrolled quite a bit more. The patients enrolled from every state in the US and also from Puerto Rico. So we have a really diverse and representative group of patients. And we had people with a wide range of kidney diseases. So we had, I guess, 14 people with FSGS in the first year, 26 with IgAN, 37 with polycystic kidney disease, 80 with diabetic kidney disease, 100 with kidney disease due to high blood pressure, and so on and so on. And that diversity is crucial because it lets us understand how these different types of kidney disease are progressing and responding to treatments. And moving forward, it's going to be important for us to get our numbers up across all those different categories of disease. And that way we'll have a rich data set that the researchers can comb through and try to find patterns and try to figure out how to, interfere with the disease progression and maybe even stop it completely. We're still at an early stage of the study, so we don't have any major findings to date, but we are getting some insights that can help to shape future research. As I mentioned earlier, 70% of people, when they enroll into the study, say that they're interested in being notified about clinical trial opportunities. So that shows a really high level of engagement and a willingness to participate in clinical research. And that could help to accelerate the development of new therapies as they start to enter into the pipeline. And that could make them available to people out in the community even more quickly. So looking ahead to year 2, we're going to keep expanding the registry, enrolling more and more people with, all different kinds of kidney disease and at all different stages. Our goal is to ultimately enroll 50,000 patients, similar to what they did with the Cystic Fibrosis Foundation Registry and others. So we're just going to keep working towards that target over time. But even in the meantime, in the next few years, we think we're going to have enough data to start to allow the researchers to find patterns that could really, lead to detecting symptoms at an earlier stage, developing new treatments, and someday possibly that cure that we're all after.
I think that this whole thing that we've talked about, this survey, if you will, or research project or registry, I think the terminology registry means I signed up. Okay. There are things you can sign up for in life, like the draft, or you can sign up for anything that you want to, but I don't know of anything more specifically and earthbound than this kidney disease study. I really believe in it. And I think everybody that listens to this podcast and shares it would be encouraged to share it. You know what? We've had a few glitches in here. So what? I mean, technically, that's what happens. But the gist is, if you go to KidneyCAREStudy.org, if you just click on that, it's not just the survey itself, it's multitudes of things that we've talked about. And you can, they say, give it a shot, do something 7 times and people are going to listen. Get in there and look at it. Do a study for yourself. And then biggest thing, pass it along. There's no reason in the world for you to just hold this. And there's no reason for you to be scared to take the registry. None. 0. All right. And it doesn't have to be done in one sitting. You can take this on like a novel. Just read first chapter and second chapter. Just do it. If you don't do it, all right, if you don't focus on completing the task, people suffer, including you. All right? I'm serious here. This is people's lives we're talking about. All right? I've lived with this disease for 50 years, maybe longer. And I can tell you one thing, I got to get old. And a lot of people don't get to get old. So if you want to if you want to help the kidney community, get involved in this project. And I can tell you it's going to be beneficial to you and to a whole lot of other people. So if you guys, Rachel, Sandy, if you have anything else to say, this would probably be a good time to do it, because we're about ready to end the podcast.
Thank you, Kent, for supporting us through the years. Thank you for advising us to help get the study ready to launch. And thank you for taking part in it and sharing your own data. And thanks for getting the word out so that others can hear about it and participate too. So that's all tremendous. You're really helping to move things forward with us.
We have time to do this. You can take time to do this, but if you don't take time to do this, we don't make progress. Progress comes from participation, and I'm asking you, I'm pleading with you to go to KidneyCAREStudy.org and do the survey. Help others and yourself, and you can't go wrong. So until we meet again, I want everybody to realize that this process is a long road. Some of us are just starting, and those are the ones that will benefit the most from this project, but they got to have more information, and you can share that with them. So get on the trail. Let's work it together. Let's take the journey together. Until later, everybody, I want you to keep breathing.